We're at the 2019 CROI here in Seattle. We're here with Sharon Hillier from the University of Pittsburgh, who's been a long-term activist, physician, researcher over the years, who has been doing the good work and pushing the buttons that make things happen. But I think more than that, it's more about the education. We talked about that just before we started this program here. So tell us what your passions are right now, because I think they're poignant for our community to really understand some of the important things we need to be doing.
Yeah, I mean, I think, Fred, that one of the things that I'm really excited about this year is just as we get excited about cure and all of the things and the promise that could happen with cure, we are still in a point in the epidemic where we're seeing 100 new infections every day in the United States and 5,000 every day globally. Mm-hmm. So no matter how hard we work at linking people to treatment, we still have to keep our eye on how to prevent infections. And so I hope people can come away from this meeting really energized about how we need to put the same kind of laser focus on linking people who need prevention into prevention services, mm-hmm. as we do with linking people who need treatment, mm-hmm. onto treatment. Mm-hmm. So I think we just need that same kind of parallel thing. The other thing that I'm really excited about this year is the increased emphasis and recognition of the STI epidemic. Mm-hmm. And so, we're seeing this resurgence globally of syphilis in the United States with 1,000 cases of perinatal syphilis now, mm-hmm. and congenital syphilis, which is really shocking when you think about in mm-hmm. the year 2000, we were saying syphilis was going to be gone from America. Mm-hmm. And here we are, nearly 20 years later, with nowhere close to that target, mm-hmm. seeing huge increases. So the real question is, how do we think more broadly as HIV researchers into integrating better all of reproductive health, right? Mm-hmm. Not just HIV, but how do we really think about tackling new strategies to control STIs a lot better?
Mm-hmm. And there are a number of people who are very prolific with their sexual activity, and I don't know that we're going to change that, but at least they should have be afforded the opportunity to understand why they're getting the infections, and if they're at risk for HIV, they should be on
PrEP
or condoms, like we were saying. You're not going to stop the STIs if you have
right. I think I understand why people don't want to use condoms. Mm-hmm. I totally get it. Yeah. And yet I think we need to be a little bit more open about some of the problems with getting STIs. Mm-hmm. There's this really crazy balance that we have to strike between stigma, and we don't want to stigmatize mm-hmm. people enjoying sex and having mm-hmm. a great time. But at the same time, we want people to understand that there can be long-term consequences. Mm-hmm. So at this meeting, we heard some interesting information about how people are getting syphilis and are having hearing loss. Now, we knew about this 50 years ago, mm-hmm. that people with syphilis had hearing loss. But what we're learning now is young people coming in who have picked up syphilis as part of their sexual activity at a young age are having hearing loss.
And it advanced that quick.
And it advances very quickly. And it's not just people with neurosyphilis. Mm-hmm. So that, I think, is really interesting. And there was another really interesting presentation here on people having cognitive declines. Young people having cognitive declines because of syphilis, and more syphilis is worse. Mm-hmm. So I think, although we want people to have a great time when they're having sex, mm-hmm. and sex should be about pleasure and fun, mm-hmm. I think people should also think about how to preserve their own long-term well-being. Yep. And making sure that they're, if they aren't certain about the safety of their partners, to use condoms when they can, because there are real benefits to not getting these infections. Mm-hmm. They're not as simple or as innocuous as people have been led to believe.
Mm-hmm. So we have people that are getting, we are able to quantify many more years of life.
Right.
But if we don't have a quality of life for that
right.
whole long period, it's really something. I think maybe we just have to have a serious Dutch uncle talk and say, look, this is the truth. This is the realities.
Right.
This is how to conduct your life in such a way that you would enjoy your life, enjoy your sex, but also to preserve your quality of life right. down the line. and it's a balance, but there are ways to do it. And the more we come out with the science on the things that people can get, and I don't know, is this syphilis a different version of syphilis?
No, it's the same old garden variety syphilis.
But it just seems that younger people could
right.
end up with serious problems with their health beyond just the infection.
That's right.
Yeah.
And so, the other place we're seeing it now, because people have sex with different people, and it has moved into pregnant women. We're seeing an epidemic of pregnant women with syphilis in the United States as well. So, I think we just have to own again. People forget that during the First World War, more people were hospitalized because of syphilis than war injuries.
Wow.
It was the plague, it was the HIV epidemic of its day, right? Untreatable. And then with the advent of penicillin, which is still a terrific treatment for syphilis today, it kind of went away. But another thing that we learned is that some of the treatments like penicillin are really in short supply. There's just like two places in China that make most of the world's supply of penicillin. And so, the supply chain's not strong. And what that means is that if something happens at one of these Chinese plants, Americans aren't going to be able to get that benzosine penicillin. So I think it's something we haven't. I was really shocked when I understood not only are we having an epidemic, but the treatment that's best is really at risk as too.
Yeah.
So.
And you really have to be, the other thing, you might want to speak to this, the issues around drug resistance. And it certainly is there in TB and almost any disease we're using antibiotics. And there just doesn't seem to be new antibiotics coming down the pipeline.
No, the golden age of antibiotics was back in the 80s, 1980s. And so now there are strains of multi-drug resistant gonorrhea. So there is some clap you just can't treat unless you go in the hospital and have IV antibiotics. And even that is not really the best kind of treatment. And so, I do think we need to be a little less sanguine or a cavalier about getting STIs because I think they can have real effects. And some of them, I think we have lost easy treatments because a lot of the gonorrhea in particular is resistant.
And one way to avoid making it resistant to the virus or the experience you have is the fact that you have to take the whole course of treatment. And I can't emphasize that enough. That is so critical. And it's just like we were talking earlier, the people that misinformed about that their viral load is low, and the doctor says, and maybe their visit even says, you are undetectable. Well, they immediately know that there's a cure out there that for one person, and now they think, oh, I'm the second person. It's so bad that we have to make sure people know what is the cure. What does the cure really mean? No one has the cure right now. We're talking now, even the second patient is remission rather than cure. But the point is we have to make sure people understand that when they go to undetectable, they're still going to be on treatment probably their whole life, one form or another. And that will keep them to a point where they can live their life fully and in a way that produces a quality of life.
Absolutely. Yeah.
So I'm hopeful that these are messages that we have to get out, and I know that we're not going to get them all right here on this video, but it needs to be repeated over and over again, and in ways that especially the less well-informed community, the community who isn't engaging in information, somehow or another they have to get it. Obviously, if they're getting STIs, they go to a clinic. They should be made to watch a video and say, look, this is important for you to know. And about taking the medications to the full extent of the duration of the treatment, and also how to prevent STIs as well as HIV and so forth. It's really important. And I thank you so much for being here with us and giving us your wisdom and talking about a few of the trials that are out there.
Thanks so much, Fred.
Very nice. Thank you.